Welcome to another episode of Ask a Psychologist with Ms. Hana Haniffa. Today, we are here to talk about post traumatic stress disorder, also known as PTSD, in children. PTSD is a mental health problem. It can affect people of all ages. A child with PTSD keeps having scary thoughts and memories of a past event. He or she finds the event terrifying, either physically or emotionally. So let's learn how a parent or caregiver could support a child who has PTSD. Hi, Miss Hannah. Can you please introduce yourself?
Hi, I'm a lecturer in psychology with a master's degree in psychotherapy and counseling and a bachelor's degree in psychology. I've been teaching psychology at various institutions around Sri Lanka for the past 13 years, and I've been working with various programs ranging from diplomas to even master's degrees.
What is PTSD?
So, PTSD is also known as post traumatic stress disorder. It is a mental health condition that occurs in many people who have experienced or witnessed any traumatic events in their lives. This includes adults and children generally.
What causes PTSD in children?
A traumatic event that happens or that has happened to the child or happened to someone close to the child, or even something the child saw, like accidents, natural disasters, bombings, rape, torture, kidnapping, physical and sexual abuse, surgeries, and any other medical procedures could cause PTSD in children.
What are the symptoms you would observe in a child affected by PTSD?
Children show or express different symptoms. Symptoms usually vary from child to child, but usually children express a few symptoms that might be common to all of them. And that's what we're going to look at here today. So, emotional physical suffering, when exposed to situations that usually reminds them of the traumatic event, could be the first trigger. They would commonly have nightmares and disturbing memories of the events. They could also have problems falling asleep. They would also be depressed or have a bad temper or often be violent. Sometimes they feel nervous or they would feel a little anxious around the places the event might have taken place or the people that might have caused the events to occur, as in the abuse or the trauma to occur. They also lose interest in the things they like the most, and they would have trouble feeling affectionate. They would also distance themselves from the places and the people that might have caused the event or the trauma to occur. So if you notice that children prefer to stay away from certain people or certain places, you might have to be a little alarmed about it, and you might want to look into what that might be and why they might be feeling that way. They would also have trouble focusing and have trouble problems in school. So concentration and memory might be affected by PTSD or PTSD related symptoms as well. Some might even revert back to thumb sucking or bedwetting, which might be a habit or a behavior they might have grown out of, but might tend to kind of go back to it again. On top of that, they would also suffer from headaches or stomach aches more often than usual. And as a parent, you would notice that it's a little unusual that they would have headaches or stomach aches frequently or have other physical complaints more frequently than they used to.
How can you help a child affected by PTSD?
A child affected by PTSD is a child that would usually need a lot of love and comfort. So you have to act calm and respond consistently to the child's needs and provide simple explanations to why they feel that. You need to make them safe and make them feel safe at all times as well. maintain a routine, encourage children to share feelings and the stories attached to them. So having a routine to talk to them and communicate with them regularly, where you would help the child open up and speak about the problems that they might be experiencing, would be an easier way to help the child feel better. And when they start talking about the stories attached to how they feel, that would also start making them feel a little safer, as they can see that there is someone that is willing to listen and that they're able to share their stories with. So always ensure that you are available for them and that they understand that you're available for them at all times as well. Talk about the things that are going well and also spend time in talking to them about how your day goes and how you have spent your day. So this encourages them, and this also falls as a role model to opening up about anything and everything that they experience in a particular day. And this would hopefully fall as a way to encourage the child to speak up and open up about their experiences throughout the day. You could also try to keep things as normal as possible. And by normal, we mean that even if the environment or the place feels unsafe and the child feels anxious over it, you try to keep things calm as an adult, and you try to encourage the child to also feel safe and calm until you could get yourself away from that event that might be traumatizing or that might be, falling as a trigger to the child at the end of the day. It's also helpful to keep them busy so their thoughts and their emotions are distracted by the activity that they're engaged in. So when they are free or when they don't really have any activity to engage in, it's an easier way to kind of distract them into thinking back at the memories, thinking back at the event that might have happened, and also causing them to feel anxious because the mind starts to wander. So keeping them busy usually helps keep them engaged and keep them focused on that particular task and not let their mind be diverted and not let their thoughts be diverted as well. Let them know that anger and sadness are typical. So if you can let them know that anger and sadness are okay to feel and that they can express their anger or they can express their sadness and that they can have an opportunity to kind of open up about it, then this is something that they will be able to freely express. So bottling up anger or bottling up sadness could always lead to a lot of trouble. And that could always make them feel depressed or sad. And it also could make them feel difficult, right, emotionally. So if you could always kind of encourage them to express their feelings, and either they express it by talking about it, or they express it by crying or venting a little, that would also help the child adjust easily.
What are the available treatment options?
Treatment options always vary by the child. So every child and their particular case would vary from another child. So depending on the child's experiences, depending on the child's condition or the level of their condition, their treatment options would vary. But generally, trauma focused cognitive behavioral therapy is one of the options that is commonly used. This type of talk therapy uses talking and learning activities guided by a mental health therapist or a professional. For younger kids, trauma therapy includes talk, play, drawing, and even story activities, which would encourage the child to express themselves and express their emotions, and would also help them kind of keep them busy and diverted, and right at the same time, kind of heal from the events that might have happened. A parent or a caregiver is almost always welcome during the therapy, so they could witness how things take place and they could also learn how to help the child cope with the situations that might come up later after the therapy. It can also help any child who has been through trauma and not just those who have PTSD. So, not everybody who experiences a trauma are, um, are diagnosed with PTSD, but some might get, diagnosed later on with PTSD, while the others would just go through the trauma. So these types of therapeutic situations would usually help them overcome these therapies, overcome these issues. Getting therapy soon after trauma helps children cope well. So, providing support as soon as possible, the earlier the intervention, the better it is. So, always making sure that as a parent or as a caregiver, that you do the needful to get your children help as soon as possible would be the best thing to do. So therapy usually helps them deal with the first experience of the trauma and also kind of help them as a first aid. So it'll prevent further damage and it'll kind of keep the child stable and help the child recover from what has happened. So the sooner the intervention, the better it is because it helps further damage and it also helps the child learn how to cope with the situation and not get into further trouble and not start developing further symptoms.
What are the aftermath effects of PTSD in children if not treated?
The aftermath, if not treated, is that they tend to shut people out of their lives regardless of who they are. Now, when trauma occurs, one of the common things that happens is that the cause of trauma, whether it's a person or an event, especially children, start shutting people down because they lose the concept of trust. Now, as we understand, children develop trust and mistrust at a very young stage in life. And this comes through nurturing and healthy parenting and good caregiving and things like that. So when they experience an event that leads to mistrust, that leads to pain or hurt, then they start learning that trusting people would be a difficult thing to do. So as a consequence, what they do is they learn to push people away from their lives and they would kind of start being more reserved and more away from social contact, which is an extremely unhealthy behavior. So, if PTSD or related issues are not treated in children and not given the necessary support at the correct time, there is a higher tendency for them to move away and shut down people from their lives. They will also have difficulty in managing their anxiety or the depression that might also be kind of something that coexists with these types of conditions. So, if not treated on time, it could lead to severe levels of anxiety, severe levels of depression, and other mental health issues that might make it difficult to cope with. This also causes them to have slower capability to learn, lower IQ, memory issues, damaged social and emotional responses, and also have a very defensive personality because now they're trying not to get hurt again. They're trying not to, be traumatized again. So they're going to start naturally becoming very defensive, which is not really healthy when you're trying to build a social relationship with others in the society. These can also make a child with PTSD very difficult to approach. So it could lead to more and more problems in adulthood as others would find it difficult to connect with the child. So the child starts to have trouble making friends in school, making connections in school. They would not be able to build relationships with their teachers, parents, caregivers, and friends, and kind of form that natural network that they should form as a child. So this leads to a lot of trouble as they will grow up to be adults would also find the same problem to continue. So growing up into an adult with very little social contact could be very difficult to lead a normal lifestyle. So it is extremely important to treat people with PTSD or treat children with PTSD and other emotional trouble or psychological issues at a very early stage.
Subscribe to our channel and watch more of our Ask a Psychologist interview sessions. You can also drop your questions in the comments and we'll be able to answer them in our next video.